All right, chapter 29, sexual assault. This kind of ties right into our last chapter we just did. So, sexual assault and sexual violence is any unwanted sexual advances and sexual harassment. These things can include stranger rape, marital rape, date rape, drug facilitated sexual assault, incest, human sex trafficking, and female genital mutilation. So rape is considered non-consensual activity. It's any penetration of the vagina or anus with any object or body part, or the oral penetration by sex organ of another person. And actually, in our legal system, penetration is considered, for a woman, penetration is considered anything past the labia. So it doesn't even have to be inserted into the vagina itself. It's at any touching or penetration, not anything that goes beyond the lips of the labia. It is the second most violent crime, rape is. Attempted rape refers to the threat of rape or intention to rape that was unsuccessful. And nurses are instrumental in providing holistic care for sexual assault victims and preserving evidence, which we're going to talk about SANE nurses in this lecture. So epidemiology: 1 in 5 women and 1 in 71 men in the United States have been raped at some time in their lives. Males are more likely to experience physical trauma and be victimized by multiple assailants. So, a lot of that is because many of the male rapes that happen in jail systems, or prisons. Reduction of sexual assault cases. So there has actually been found there's been this reduction in the past so many years in rape cases, and some of the reasons for that is the policies for longer sentences for perpetrators, mandatory sentences. So there's sentences that the judge can't even do anymore. There's mandatory sentences, and trained healthcare workers who specialize in sexual assault. Whoops. Spousal or marital rape. The perpetrator, almost always a male, is married to the person who is raped. Acquaintance or date rape is the perpetrator is known and typically trusted by the person that has been raped. Females know their offenders in almost 70% of all violent crimes committed against them. Males know their offenders 45% of the time. So again, that goes back to the nature of where men are typically typically raped or violated. Date rape drugs can render the victim incapable of resisting and can cause amnesia, so the people actually won't even remember what had happened to them. And the Drug-Induced Rape Prevention Act allows for up to 20 years imprisonment for anyone who intends to commit a violent crime by administering a controlled substance to an unknowing individual. So you can get up to 20 years just from tossing a pill into somebody's drink. So it's very serious. Acute stress disorder, we talked about this in class a little bit, is the psychological reaction to serious trauma. So witnessing a death, suffering from serious injury, or a sexual violation. If symptoms of acute stress disorder last more than a month, it can lead to PTSD. And again, we just talked about that as well. That is re-experiencing avoidance and hyperarousal. Remember again that hyperarousal means like more aware, more keyed in, more tuned in to everything that's going on. Remember the startle reflex. It doesn't have anything to do with sexuality. Be sure you know the definitions of those three. Psychological effects, so depression, suicide, anxiety, fear, difficulties with daily living, low self-esteem, sexual dysfunction, somatic complaints, so things that are feeling like they're wrong, but there's no underlying evidence for it. Effects of incest, so this is super huge, not talked about, but it happens all the time. So the victims may experience negative self-image, depression, eating disorders, personality disorders, self-destructive behaviors, and substance abuse. So again, all these things we've learned about up until this point, like the personality disorders and substance abuse and depression, right here is saying that somebody who is abused may have those things. And every time we've talked about those different things, it always leads back to some kind of childhood trauma, or most times. Okay, so SANE nurses, these are sexual assault nurse examiners. These are RNs with specialized training in caring for a sexual assault victim, demonstrated competency in conducting medical and legal evaluations, and they have the ability to be an expert witness in court. So a lot of ERs will actually hire a SANE nurse to work and, you know, collect evidence from the patient after they've been assaulted, and that's going to be a really delicate process. So it's going to take a lot of patience and empathy, not sympathy, but empathy, like being there for their situation and understanding that this is very difficult for them. Sexual Assault Response Team, also known as SART. This is a whole team that's made up of a lot of different professions, I guess. Members include nurses, physicians, attorneys, social service workers, advocates, mental health professionals, lab personnel, and other agencies. So this is a team that comes together to basically review and take care of these cases. So our assessment data, we want to get the info from the patient, do the exam, document all the findings, collect the evidence, and follow up as needed. Historically, so in the past, there have been long waits for sexual assault patients in emergency rooms, but currently sexual assault victims are considered a priority. So instead of having to sit and wait because there's all these other priorities there, they're now also considered priority, which makes sense because having to sit there after being assaulted would be extremely hard on the person. So here's some behavioral responses that you may see in the patient and coping mechanisms. Crying, withdrawing, abusing drugs or alcohol, talking about the event, becoming agitated, confused, disoriented, incoherent, laughing or joking. So a bunch of different things. They kind of all go over the spectrum there, things we might see in a patient who has been the victim of sexual abuse. And then positive responses by the patient: at least I'm alive, I know I can move forward. Negative responses: it's my fault what happened, I shouldn't have worn that skirt, or I was being flirtatious so I caused it. You know, that victim is blaming their own selves as if they could have done anything to stop the perpetrator's mind and their actions. You know, we have to get away from victim blaming in our culture and our society, because we do like to, not we like to, but it just naturally seems to happen that we end up blaming victims. Emotional and physical trauma: if suicidal thoughts are present, nurse should ask, are you thinking about harming yourself? Have you ever thought about or tried to kill yourself before this attack? So any injuries that the patient has needs to be carefully documented. That's more than just the sexual injuries, that's the whole body. Ask the patient if they know how specific injuries occurred. So if they have a big lump on their head, ask them, like, well, what happened to your head? Like, how did this bump end up getting here? You know, we want to see if they know how the specific injuries occurred. Now, they may not. As a nurse, support the patient during exam, as this may be experienced as another violation by the patient. So best practice: patient has the right to decline parts of the legal or medical exam. Informed consent and consent forms signed before any photographs can be taken. A shower and change of clothes should be available to patient as soon as examination and collection of evidence is complete. So we make them a priority now because we need to get that done so they don't have to sit there like that, and then they can eventually wash, because I can only imagine that that would be exactly what a person would want to do, is be able to go sit in a shower, but they cannot do that until after the evidence and everything is collected and the examination is complete. About 5% of women who are raped will become pregnant as a result. And so emergency contraception or morning after pill made available. So these do not cause abortion. They act on the follicular development and inhibit ovulation. So you just have to see how you feel about that personally. But again, we're there for the patient. Nurses need to check their own selves. Nurses' attitudes influence the care received by rape victims. Check out table 29.2 on page 558. It's examine personal feelings about myths and facts about rape, and examine personal feelings about abortion, as a patient might choose an abortion if pregnancy results from a rape. So, by virtue of the legal definition of the relationship, rape cannot occur within a marriage, and that is false. And then flashbacks, frightening thoughts, recurrent memories, or dreams are associated with which category of symptoms in PTSD? And this would be re-experiencing.